Cleanup crews fanned out to local beaches on this Memorial Day holiday yesterday and over the weekend. Save Our Shore is targeting 5 beaches that stretch from Del Monte Beach up to Panther Beach, picking up almost 1,000 pounds of garbage over the course of the 3-day holiday.
Plastic utensils, styrofoam containers, basically all the makings of a picnic, charcoal, a lot of bonfire stuff, a lot of burned trash, which is also really bad for the environment, bad for the air, to burn plastic and to burn your waste and then to leave it in the sand.
Well, in addition to all the trash that was left behind, there was also a used syringe found at Seabright Beach by some kids that were digging in the sand. Luckily, none of them were stuck.
Take Back Santa Cruz, along with county health officers, have been working for years to keep public places free from those kinds of needles. And this year they are reporting a drop in the number of needles found. Action News reporter Phil Gomez joins us live from Santa Cruz with an update on their efforts.
Well, Aaron, Santa Cruz County health officers say they're cautiously optimistic that the drop in the number of needles recovered means the county's outreach to drug users may be working, but there's still a lot of work to be done. Used needles discarded in public places, like the one found this weekend on Seabright Beach, have been a huge problem for Santa Cruz over the last few years. In the last 29 months, Take Back Santa Cruz volunteers recovered more than 7,500 needles from public areas. Last month, 204 were found, compared to 260 at this same time last year.
We'll see how the summer rolls, see how the numbers go, and hopefully we are seeing an improvement as in a community. Of course, 204 needles in open spaces is still a lot.
Tackling the needle problem also means tackling the county's drug problem. Santa Cruz County Health Officer Lisa Hernandez believes a reason for the drop in needle finds last month could be the outreach the department has been doing, trying to make sure drug users know how to safely discard used needles.
What we do at the syringe exchange is educate and outreach to our participants one, to try to have them stop using syringes and using drugs. That's one of our harm reduction approaches. The other is to have an opportunity for them to discard their syringes properly with the exchange as well as with the kiosks that are out in the community.
Beyond just the needle exchange, Santa Cruz County is also doing more to get users off of drugs and into treatment. Bill Manoff is the Santa Cruz County Alcohol and Drug Administrator. He says the county has expanded its methadone clinics for heroin users. In the coming months, there could be a decision to add even more programs.
I would say maybe 3 to 6 months the county will need to make a decision about whether or not to participate in the program expansion. And if the county decides to participate, then it could be another year or so beyond that, depending on how quickly the state is able to move.
And funding could come from different federal, state, and local sources, again, if the county decides to pursue drug treatment programs. Aaron?
All right, thank you, Phil. And the health officer is required by law to update the public about the needle exchange program every other year. Her last update was in 2014, but she plans to present another report later this year to the Board of Supervisors.